Health questions often begin in surprisingly ordinary ways. A casual comment from a coworker, something you read online, or a passing conversation can plant a seed of curiosity. Maybe someone mentions a specific food they swear by or a habit they believe has improved their performance or energy. At first, it might sound like another trend, easy to dismiss. But sometimes those small questions lead to much bigger conversations about how the body actually works. One of the most common topics that comes up in these moments is sexual health, particularly erectile function. It's not always discussed openly, but it's something many men think about at different stages of life. Some notice gradual changes as they get older. Others experience sudden shifts during periods of stress or illness. And for many, the question is the same: is there something simple I can do to improve this? In clinic settings, these conversations are often more nuanced than people expect. Erectile function is not just about arousal or desire. It is a reflection of multiple systems working together. Blood flow, nerve signaling, hormonal balance, and mental state all play a role. When everything is aligned, the process feels effortless. But when even one component is disrupted, it can create noticeable changes. What makes this topic particularly interesting is how closely it connects to overall health. For example, the same blood vessels that support erections are also involved in heart function. If those vessels are not healthy, if they are stiff, narrowed, or less responsive, blood flow can be affected throughout the body. In many cases, erectile difficulties can appear before other symptoms, making them an early signal rather than an isolated issue. This is where lifestyle becomes an important part of the conversation. Diet, exercise, sleep, and habits like smoking or alcohol use all influence vascular health. Yet, many people are still drawn to the idea that a single food or supplement might hold the answer. It's an understandable instinct. There's comfort in the idea that something as simple as adding a particular ingredient to your routine could make a difference. Consider a common scenario. A man hears that certain vegetables, particularly those rich in natural compounds, can improve blood flow. He starts incorporating them into his diet, not necessarily expecting dramatic results, but hoping for some benefit. Over time, he may notice subtle changes, better energy, improved stamina, perhaps even a shift in sexual performance. Whether these changes are directly caused by one specific food or by a broader improvement in health is not always clear, but the experience itself is meaningful. These kinds of questions are worth exploring, but they also require careful interpretation. Not everything that sounds promising is supported by strong evidence, and not every study translates directly into real-world outcomes. That doesn't mean these ideas should be ignored. It means they should be understood in context. Another layer to this discussion is how people interpret terms like natural or boosting. These words often appear in health conversations, especially around supplements or dietary changes, but the body doesn't operate in simple on and off switches. Instead, it responds to a complex balance of signals. Supporting one pathway may help, but it rarely overrides everything else. For many men, the emotional side of this topic is just as important as the physical one. Concerns about performance can lead to anxiety, which in turn can make the problem worse. It becomes a cycle, worry affecting the body, and the body's response reinforcing the worry. Breaking that cycle often requires both understanding and reassurance. This is why education matters. When people understand what is happening inside their body, the conversation shifts from fear to curiosity. Instead of asking, "What's wrong with me?" they begin to ask, "What can I improve?" That shift opens the door to more effective, sustainable solutions. As we move deeper into this discussion, we'll explore one of the most talked about mechanisms behind erections, nitric oxide. This small but powerful molecule plays a central role in how blood vessels function, and it's often mentioned in conversations about diet and supplements. Certain foods, including vegetables like beets and leafy greens, are believed to influence its levels in the body. But how does that actually work? And more importantly, does it translate into meaningful changes in erectile function? Understanding these questions requires looking beyond simple claims and into the biology behind them. Because when it comes to sexual health, the answers are rarely as simple as they seem, but they are often more reassuring than people expect. To understand how certain foods might influence erections, it helps to look closely at the biology behind the process. An erection is not simply a matter of desire. It is a coordinated event involving the brain, nerves, blood vessels, and smooth muscle tissue. When a man becomes aroused, signals from the brain travel down the spinal cord and into the nerves of the penis. These signals trigger the release of a chemical messenger called nitric oxide. Nitric oxide is often described as the starting signal for an erection, and for good reason. Once released, it sets off a chain of events inside the blood vessels. It tells the smooth muscle in the vessel walls to relax, allowing those vessels to widen. As they expand, blood flows into the erectile tissue more easily, filling the chambers that create firmness. When nitric oxide levels are adequate and the blood vessels respond properly, this process happens smoothly. When they are not, the response can be weaker or delayed. This is why nitric oxide has become such a central focus in discussions about erectile health. Many medications used to treat erectile dysfunction, such as those in the PDE5 inhibitor class, work by enhancing the effects of nitric oxide. They do not create arousal on their own, but they help the body respond more effectively to the signals already being sent. Naturally, this has led to interest in whether the body's own production of nitric oxide can be supported through diet. Certain foods, particularly those rich in natural nitrates, have been studied for their potential to increase nitric oxide availability. Vegetables like beets, arugula, spinach, and other leafy greens fall into this category. Here is how it works in simple terms. When you consume foods high in nitrates, your body converts those nitrates into nitrites and then into nitric oxide. This process involves both your digestive system and bacteria in your mouth, which play a surprisingly important role in the conversion. The result is a potential increase in nitric oxide levels, which may support better blood vessel function. Some studies have shown that consuming a certain amount of dietary nitrates can measurably increase nitric oxide in the bloodstream. This is often associated with improved exercise performance, better circulation, and lower blood pressure. From a cardiovascular perspective, these are meaningful benefits. However, the key question remains, does this translate into improved erectile function? This is where the science becomes more cautious. While we have strong evidence that nitric oxide is essential for erections and that nitrate-rich foods can increase nitric oxide levels, there is less direct evidence linking specific foods like beets to consistent improvements in erectile performance. In other words, the mechanism makes sense, but the real-world outcomes are not always as clear-cut. One reason for this is that erectile function depends on more than just nitric oxide levels. If the blood vessels themselves are damaged due to conditions like diabetes, long-term smoking, or severe cardiovascular disease, then simply increasing nitric oxide may not fully restore function. Similarly, if nerve signaling is impaired, or if psychological factors such as stress or anxiety are present, the response may still be limited. That said, there is a reasonable argument for including these foods as part of a broader approach to health. Supporting blood vessel function is beneficial not just for sexual health, but for overall well-being. Improved circulation can have positive effects on energy levels, physical performance, and long-term cardiovascular risk. It is also important to distinguish between natural dietary sources of nitrates and those found in processed foods. The nitrates present in vegetables come packaged with vitamins, fiber, and antioxidants that support health. In contrast, nitrates in processed meats are associated with less favorable outcomes and should not be considered equivalent. Another area that often comes up in this discussion is the use of supplements marketed as nitric oxide boosters. Many of these products promise enhanced performance, but their effectiveness varies widely. Some ingredients, such as L-citrulline and L-arginine, have shown modest benefits in small studies, as they are involved in the body's nitric oxide pathway. However, results are inconsistent, and not all supplements contain effective doses or high-quality ingredients. In clinical practice, this is where expectations need to be managed carefully. A patient might come in after trying multiple supplements with little to no improvement, feeling frustrated or misled. In these cases, it becomes important to refocus the conversation on evidence-based approaches and the bigger picture of health. There are also individual differences to consider. Not everyone responds to dietary changes in the same way. Factors such as age, baseline health, and existing medical conditions all influence how the body processes nutrients and responds to interventions. For example, someone with well-controlled blood pressure and no major health issues may notice subtle improvements, while someone with more advanced vascular disease may not experience the same effect. Ultimately, the role of nitrate-rich foods like beets is best understood as supportive rather than curative. They can contribute to a healthier vascular system, which is a key component of erectile function, but they are not a standalone solution. When combined with other positive lifestyle choices, regular exercise, good sleep, stress management, and medical care when needed, they can be part of a comprehensive strategy. As we move into the final chapter, the focus shifts from understanding the science to applying it in everyday life. The goal is not to chase a single answer, but to build a realistic, sustainable approach that supports both sexual health and overall well-being. When you bring all of this together, The most useful takeaway is not that one specific food will transform erectile function, but that the body responds to patterns, what you eat consistently, how you move, how you manage stress, and how well you take care of underlying health conditions all work together over time. Beets and other nitrate-rich foods can absolutely be part of that pattern, but they are one piece of a much larger system. In real life, this often looks much simpler than people expect. It might mean adding a serving of leafy greens to your meals, including vegetables like beets a few times a week, or choosing whole foods more often than processed ones. These are not extreme changes, but they are meaningful when repeated regularly. Over time, they support healthier blood vessels, which in turn support better circulation throughout the body. At the same time, it is important to be realistic about expectations. If someone is dealing with erectile dysfunction, especially if it has been present for a while, it is rarely caused by a single factor. It may involve vascular health, nerve sensitivity, hormonal balance, and even psychological influences. Because of this, improvement often requires addressing several areas at once rather than focusing on one solution. For example, a man who improves his diet but continues to smoke may not see much change because smoking directly damages blood vessels and interferes with nitric oxide production. Similarly, someone who eats well but has uncontrolled diabetes or high blood pressure may still struggle because those conditions affect circulation at a deeper level. This is not discouraging. It simply highlights the importance of a comprehensive approach. Physical activity is one of the most powerful additions to that approach. Regular exercise improves blood flow, supports heart health, and enhances the body's ability to produce and respond to nitric oxide. It also has benefits for mood and stress levels, which can significantly influence sexual performance. Even moderate, consistent movement can make a difference over time. Stress is another factor that is often underestimated. When the body is under chronic stress, it shifts into a state that is less supportive of sexual function. Hormones related to stress can interfere with arousal, and the mind may remain distracted or tense rather than engaged. Creating space for rest, relaxation, and mental recovery is not just beneficial, it is essential. There is also value in paying attention to how you approach sexual experiences themselves. Performance pressure, expectations, and anxiety can all interfere with the natural response cycle. When people begin to focus less on outcome and more on connection, comfort, and communication, the body often responds more easily. This shift can be just as important as any physical intervention. For those who are curious about incorporating foods like beets specifically, the approach can remain practical. There is no need for extreme quantities or rigid routines. Including them as part of a balanced diet is enough. They can be added to salads, blended into juices, or incorporated into meals in ways that feel natural. The goal is sustainability, not intensity. It is also worth noting that while certain supplements are marketed as nitric oxide boosters, not all of them are effective. Some ingredients like L-citrulline or L-arginine have shown modest potential in research settings, but results are not guaranteed. More importantly, supplements should not replace foundational habits. They may play a supporting role, but they are not a substitute for overall health. In clinical conversations, one of the most helpful shifts is moving away from the idea of a quick fix. When patients understand that their body is responding to a combination of influences, they often feel more empowered. Instead of relying on a single change, they begin to see how multiple small adjustments can work together. It is also important to know when to seek medical guidance. Erectile dysfunction can sometimes be an early sign of underlying health conditions, particularly those affecting the heart and blood vessels. If symptoms are persistent, worsening, or associated with other concerns, speaking with a healthcare provider is an important step. Addressing the root cause not only improves sexual health, but also protects long-term well-being. What becomes clear over time is that sexual health is deeply connected to overall health. It is not separate or isolated. The same choices that support your heart, your metabolism, and your mental well-being also support your ability to function sexually. This connection can be reassuring because it means that improvements in one area often benefit others. In the end, incorporating foods like beets into your diet is a positive step, but it works best as part of a broader, balanced approach. When you combine good nutrition with physical activity, stress management, and appropriate medical care, you create an environment where your body can function at its best. That approach is not only more effective, it is also more sustainable. It allows you to build habits that support your health over the long term, rather than chasing temporary solutions. And when you look at it from that perspective, the goal shifts from fixing a single issue to improving your overall quality of life. That is where the real value lies.